anyone gets injury in the scalp, it bleeds profusely. But you need not panic, or in the emergency, if the person comes with a scalp bleeding, don't get panicky. You just, know the anatomy and the blood supply of the scalp. That's why if you have one gamcha or any the odna, you just tie tight with a knot, the bleeding will stop. And it happened one conference in Calcutta, in the plastic surgery conference. I was lucky enough to meet Professor I.T.N. Jackson, who is one of the most famous surgeon, craniofacial maxillary surgeon, and he held a live workshop in Amri Gold Park. From that day, I don't fear. I don't fear. I attended many emergencies in my life and still attending or operating on many persons. But one thing I tell you, I'm giving the workshop I.T.N. Jackson performed, I would say, in Amri, Kolkata. He's a person who stays he's New York based, he stays 5 days in New York and 5 days in Europe, 5 days in Southeast Asia. He just moves, globally he moves. And this lady was admitted, she was operated in Apollo Chennai twice with a massive injury, road traffic accident. See, the zygomatic bone of the skull and some other bones were destroyed, but main thing is this thing, and whatever the emergencies, they had performed operation, but this thing a face was distorted. Now, just see, now, he made an incision on the posterior aspect of and what he did is that he pulled the skull up to this, your scalp up to this level. It is like this. He pulled like you wear a gloves. Then you open, you just withdraw your hand. Similarly, the scalp was lifted up, made an incision and lifted up and put it up to this level. Imagine. And what he did is that from the parietal bone, he took a piece of bone like this. From the parietal bone with electric saw like pen. And what he did is he marked with a marking pen. You get surgical pens as a marker, sterilized, gamma sterilized. He drew a small piece on the skull, the parietal bone. What he did, he took a electric saw and he went on like this. He cut like this. He cut like this, a square table. And he took a hammer and chisel. It's like this. Tick, 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 right? So he has to be so meticulous and precision that the meninges can be injured, but he is such a skilled person that he lifted up the bone without injuring the brain, the meninges even. Then he took that thing, he drew this piece. When you study dichomatic bone, it is like this. Then he cut off with the electric saw and he took this piece. Then what he did is that he placed it here and put 3 screws. And the bridge of the nose, the nasal bones here, was fractured and depressed, giving the depressed. What he did, he took this piece of bone and he placed it here. He placed it here. And he asked the OT sister in Amri that, sister, do you have a screw? She said, no, we don't have that small screw. Okay, that will be okay. And what he did is that he took a piece of steel wire and he put it here and just twist it like when you put a wire and you want to fix up something, you just twist it and then he cut it. And that nose was placed. This zygomatic that was fractured, that was placed in with 3 screws. And then what he did, now it was in this level. It took it. From here it went. He just again, from the front, he put the cap, like a cap you are using, that, or you can say, imagine that when you go for swimming, you have a scalp cap. It is like that. So when you, after swimming, you just open it and then you come out and rest is. Now, why I am telling you that, whenever you get a scalp bleeding anywhere, like this, with tarwal or axe, you just tie a bandage or you tie and transport. And when they come to you in the emergencies, don't panic. You just have your emergency hemostatic forceps and all, and then you attend that emergency. Under local anesthesia, don't go for, because you don't know the condition, how much trauma the skull has, the brain has. So under local anesthesia, you can perform numerous operations. You can perform cesarean section. You can perform your gastric operations. But I'm telling you, now you suture and you can put a bandage, then go for a X-ray, go for your CT scan according to your own time. Now the vessels that is coming over here, we will see when we discuss that these vessels, they bleed profusely. But if you just want to take two hands, so you take like this, press, see the bleeding will stop. Now if you are operating a scalp tumor, sebaceous cyst, lipoma, these are the common the tumors of the scalp. So, or an abscess on the scalp, then under local anesthesia, you can operate. Now, with this introduction, I'll go to the main talk. That see, the scalp, it has a skin, it's a connective tissue, aponeurosis, loose areolar tissue, periosteum, bone. Okay, this is the section like this. Okay. Now, soft tissue, scalp, soft tissue covering the clavidia of the skull extends up to the supraorbital margin in front and external occipital protuberance and superior nuchal line. The external occipital protuberance, you just palpate and see you can palpate your external occipital protuberance. This is a protuberance in the occipital bone, which you will be seeing. It is like this. When the occipital bone is like this, it goes, there is a foramen magnum and the thing of this. You will go reading osteology and you will see it. And zygomatic arch on each side. So the Professor Jackson operated from your parietal bone he took, and then so it can the scalp. So he brought it down like this up to here. Okay. Now layers of scalp, skin, subcutaneous tissue, aponeurotic, Galea Aponeurotica, loose subaponeurotic tissue, pericranium, periosteum. Again, layers of the scalp, the skin, connective tissue, aponeurosis, loose areolar tissue, periosteum and bone. It can be a 5 marks question. Draw and write a short note on scalp. Now, subcutaneous tissue. Now, closed network of fibrofatty tissue contains blood vessels and nerves of the scalp. The walls of the vessels are firmly adherent to the fibrous tissue. Minor scalp injury results in profuse bleeding. Minor scalp injury results in profuse bleeding. Now, you see any Andolan, police lathi charges. Only a small cut, see profuse bleeding to the cameraman of all TV channels. They will focus, dekhun rokto porche, it's bleeding. But it's a small injury. Someone is putting water, mathay hath dicche. It is this thing that the walls of the vessels are firmly adherent to the fibrous tissue. The adherence naturally doesn't, this thing, that's why when you tie it, bleeding stops. Just know the concept. And these are you are now at the last end of the marathon. So these are the common things. Skin, it is the network of fibrofatty tissue, contains blood vessels and nerves of the scalp. The walls of the vessels are firmly adherent to fibrous tissue. Minor scalp injury results in profuse bleeding. But this can be a viva question. The walls of the vessels are firmly adherent to the fibrous tissue. Minor scalp. Why a minor scalp injury bleeds so much? In the viva, You may be asked when you are now you see Galea Aponeurotica situated between the occipital bellies and frontal bellies of occipitofrontalis muscle. When you read the skull bones, you will come to these terms. Galea Aponeurotica, a short note on it, situated between the occipital bellies and frontal bellies of occipitofrontalis muscle. See, this is the occipital belly, this is the frontal belly. This is orbicularis or oculi, orbicularis or ocular muscle. This is the epicranial aponeurosis. This is the epicranial aponeurosis. Now you can see the trapezius muscle. This is the trapezius muscle. Okay. Now attached behind to the external occipital protuberance and the highest nuchal line. This is the occipital protuberance here and the highest nuchal line. If you feel, you can feel it like this. Even it can contract, you can feel it, and you can feel the occipital protuberance in this level. This level. Okay. In front blends with the subcutaneous tissue at the root of the nose, here. So the scalp can be brought from the posterior to the root of the nose, and in front blends with the subcutaneous tissue and the root of the nose, and on each side attached to the zygomatic arch. Loose subaponeurotic tissues, loose subaponeurotic, loose sub tissue in the subaponeurotic space, that is consists of loose areolar tissue, contains emissary veins. These are the emissary veins. This is the now contains emissary veins, devoid of valve, dangerous area of the scalp. Collection of blood in this space produce generalized swelling and now what is the dangerous area of the scalp? A short note, and you see a head injury comes, an old head injury comes to you. Now you will see the dangerous area of the scalp contains emissary veins devoid of valves. Collection of blood in this space produce generalized swelling and a black eye. Generalized swelling and black eye. You will be noticing. And head injury with pericranial tear, safety valve hematoma. This is the head injury with pericranial tear, safety valve hematoma. What is safety valve hematoma? What is black eye? What is dangerous area of scalp? A short note question might come, and it might be in the MCQ even. Now traumatic vault fracture with meningeal tear, cephalohydrocele. Now pericranium, he asked, the pericranium, outer periosteum of the skull at the sutural lines continues with endocranium. Collection of fluid produces localized swelling, assumes shape of related bones. Now, if there is an injury of this skull, then collection, if the fluid produce localized swelling, assume the shape of the thing. Now, if it is in this space, then there will be a swelling here, but in the posterior aspect, there is no swelling. So, the area collection of fluid produces localized swelling, assume shape of related bones. Now, see, this is the artery supply, nerves and artery supply. The yellow is the nerves, and this is the arteries of the scalp. Now, one thing is that this is what I am telling you. If you press like this, the bleeding stops. Okay, because it comes from this way, and the nerves are supplying in the similar pattern. Now, supratrochlear artery, supraoccipital artery, superficial temporal artery, posterior auricular artery, occipital artery. Now, There are small tumors in the scalp. There might be a sebaceous or a lipoma. You don't go for a general anesthesia. You just inject local anesthesia and then you ask your assistant to press and you make an incision. You make an incision. See, if it is like this. Now, along the line, it is not like this. But if it is in front, then if you have to make an incision like this, but there will be a scar anyway. Okay. Now, anyway, but you have to save that patient and also now this is the supratrochlear artery, supraorbital artery above the orbit of the skull. Now superficial temporal artery, the temporal bone over here, you just do like this. You can palpate, you can see any hypertensive patient, aged patient, you will see the temporal artery is throbbing. You can see aged patient, you see the pulse, high volume, and also the arteries over here, if the person is, especially here, it will be pulsating. And now, superficial temporal artery, posterior auricular artery. If you have a small tumor, say sebaceous is very common behind the ear. So you ask your assistant to press this part and that you make an incision, there will be least bleeding. Okay? Now, occipital artery, similarly you hold it and this. Now, supratrochlear nerve, supraorbital nerve, zygomatico-temporal nerve. Temporal branch of facial nerve, motor root, auriculotemporal nerve, great auricular nerve, posterior auricular branch of the facial nerve, motor root, lesser occipital nerve, greater occipital nerve, third occipital nerve. Now, these are the nerves you will be encountering when you dissect the scalp, or there will be the nerve supply of the scalp. Then you have to write it. Arterial supply of the scalp. You draw a circle and label them. Now, nerve supply of the scalp, front of auricle, supratrochlear, supraorbital, zygomatico-temporal, temporal branch of facial, auriculotemporal nerve. These nerves, you will be encountering when you are studying the osteology of the skull and the facial bones. Now, behind the auricle, posterior branch of great auricular nerve, C2, C3, posterior auricular branch of facial, lesser occipital nerve, greater occipital nerve, third occipital nerve. This is C2, C2, C3. Now, arterial supply of the scalp, front of the auricle, behind the auricle, supratrochlear artery, supraorbital artery, superficial temporal artery. These superficial temporal artery is the pulsation can be felt and also it can be seen. You contract your temporalis muscle like this and you feel the artery. You can Now, posterior auricular artery behind the ear, occipital artery. Now, you see the venous drainage of the scalp. Venous drainage of the scalp is the parietal tributary of superficial temporal vein, here, transverse facial vein. This is cut over here. This is the transverse facial. Now, posterior auricular vein, this is the posterior auricular vein, maxillary vein, occipital vein, pterygoid venous plexus. This is the pterygoid venous plexus. Now, that can be a short note, pterygoid venous plexus, short note, and the retromandibular vein, this is retromandibular vein, posterior branch, anterior branch, this is the posterior branch, and this is the anterior branch, and external jugular vein. Here is the external jugular, and this is the internal jugular vein. Now, common facial vein, this is the facial vein here that is draining, and all drain into the internal jugular vein and external jugular vein. Now, this is the buccinator muscle, this is the submental vein, Now, inferior facial vein, labial vein, superior labial vein, orbicularis muscle oris, intraorbital vein, palatine vein, deep facial vein, superior labial vein, external nasal vein, internal orbital vein, intraorbital vein, angular vein here. It is in the nose here, angular vein. Now, emissary vein of the carotid sinus, cavernous sinus, deep temporal vein, supratrochlear vein, and supraorbital vein, and temporal fascia and muscle. This is the temporal fascia and the muscle here, temporalis muscle. Now, venous drainage. Now, the path, supratrochlear plus supraorbital angular vein. Angular vein continues as facial vein. Superficial temporal and maxillary is equal to retromandibular vein. Anterior division of retromandibular vein plus facial vein, common facial vein. Common facial vein drains into the internal jugular vein. Posterior auricular vein and posterior division of retromandibular vein is the external jugular vein. Occipital vein terminates in suboccipital venous plexus. Lymphatic drainage of the scalp. Now, submandibular nodes, deep cervical nodes, superficial cervical nodes, occipital nodes. See, any injury or infection or any a child is brought to you by the mother, they will show you there is some swelling over here in the neck region, in the scalp region. Then think of it is a lymph nodes, and you ask her if that child got an impetigo of the scalp or some infection in the scalp, abscess of the scalp, any abscess of the face or small inflammation, then the lymph node will be, the lymph will drain it there, and due to inflammatory action, the lymph node is swollen up. Now, lymph vessels in the anterior part of the scalp and forehead drain into the submandibular lymph nodes. This lymph vessels in the anterior part of the scalp. This is the anterior part of the scalp. And forehead, this is forehead drain into the submandibular lymph nodes. Now, submandibular lymph node, this. Now, again, you can see the lymph nodes here. The areas are distributed. This part is parotid gland. This is the parotid gland, occipital lymph nodes, retroauricular mastoid lymph nodes over here, deep cervical, superficial cervical, external jugular vein, and subclavian veins. The submental lymph nodes, submandibular lymph node, jugular-humoid, lymph nodes, lymph vessels, facial. Now drainage from the lateral part of the scalp above the ear is into the superficial parotid, preauricular nodes. See, this is the preauricular node. This is the area above, drainage from the scalp above the ear. Here, this area, this area drain is the parotid, superficial parotid, preauricular nodes. Lymph vessels in the part of the scalp above and behind ear drain into the mastoid nodes, retroauricular, the mastoid nodes. Any can be infection, it can be abscess or vessels in the back of the scalp drain into the occipital nodes. All the groups of lymph nodes are drained into the deep cervical group of lymph nodes. This is deep cervical, this is the occipital nodes. Applied aspect, surgical plane loose connective tissue. Tissue expanders are inserted here. Loose connective tissue is also the dangerous area of the scalp. Reason, blood and pus due to injury are accumulated here. Can spread into the dural venous sinuses and may lead to meningitis and then may lead to thrombosis. Black eye and cephalohematoma are related to the scalp. Now this applied aspect you have to note